hospitalization numbers are leveling off, and that is a hopeful sign. But the numbers are still way too high. Ask any exhausted nurse in any hospital in Virginia. Today, we reported 1,997 new cases. That's better than a couple of weeks ago, but it's a whole lot more than the start of the summer, when at one point we had fewer than 100 cases in a day. And the people who have followed the guidelines, who have made the effort to protect other people and themselves, who have gotten vaccinated, their patience is wearing thin. So let's look at where we are in Virginia. The first important point I want to make is this. The data show that nearly everyone who's getting COVID is unvaccinated. I want to repeat that. Nearly everyone who is getting COVID is unvaccinated. Here's the trend line since COVID began 19 months ago. You can see the peak there in the middle. We all remember that we hit it around the beginning of this year. Then vaccines became available, and you can see that cases plummeted. Today, more than 80% of Virginia adults have had at least one shot. This is the best rate in the South. We had almost knocked COVID out when this summer began. But then around late June, we started to see cases rising again from the Delta variant. So let's take a look at that curve. This chart is from June until now. What you can see is a dramatic increase from a handful of cases a day to upwards of 4,000 cases a day just a few weeks ago. This all was avoidable. Nearly every single one of these is a person who has chosen not to get a shot. To those people who chose not to get the vaccine, I want to give you two facts. One, these vaccines are incredibly safe and effective. They were made based on years of research. And now we have the data from millions of people around the world who have been vaccinated. And we know there have been very, very few serious side effects. Anyone who tells you otherwise is not telling you the truth. Two, by choosing not to get vaccinated, you are absolutely hurting other people. Unvaccinated COVID patients are the people filling up our hospitals right now, making it difficult for everyone else to get the hospital care that they need. And you are costing everyone a lot of money. So let's take a look at this chart. $5 billion in cost to treat a disease that could be prevented by a free vaccine. At some point, that's going to start coming out of our pockets. In fact, insurers are already starting to require people to pay part of the cost of their COVID treatment. $5 billion may not feel tangible to a lot of people, but think about whether you've got a few $1,000s laying around to pay for having been hospitalized. After all these months, I don't know what else to say to people who selfishly choose not to get the shot. If you have chosen not to get a shot, there probably isn't much I can say that will change your mind. So I'll say just this. I had COVID back before the vaccines existed. Believe me, you don't want to get it. A year later, my case was back in September. A year later, I still can't smell anything or taste anything. And now the COVID variant that's going around is a lot worse than the one I had back in September. So if you don't know what being on a ventilator is like, let me describe it. They put a tube just about the size of a garden hose down your throat to keep you alive. Having been at the bedside many times, it is miserable, it is expensive, and there's no guarantee that you will make it. So if you know that, and you still don't want the shot, then I hope you give some thought to how your family will remember you. Give some thought to what they'll do without you. Think about how you want your obituary to read, because you're taking a foolish, dangerous chance, and it affects many more people than just you. Now, let's talk about where things are for the people who have gotten vaccinated and for people who will soon be eligible to get vaccinated, specifically our children. Remember where we are because it's good news overall. More than 80% of adults in Virginia have gotten at least one shot. A full 60% of Virginia's population, including children, is fully vaccinated, and that's good news. These results put Virginia at 14th in the country. Remember, we're the 12th largest state, so that's not bad. It's important to know that most of the states ahead of us are much smaller, so it's a little easier for them. There's been a lot of conversation recently about booster shots, who needs them and who is eligible for them. This decision happens at the federal level, specifically the Food and Drug Administration and the Centers for Disease Control and Prevention. Here's what they have said. So far, Pfizer is the only company that has presented enough data for the FDA and CDC to recommend boosters. So the people who got Pfizer are the ones who should be thinking about boosters for now. Moderna and Johnson & Johnson are still collecting their data, but are not at this point yet. For the folks who did get Pfizer, the CDC is recommending booster shots for specific groups of people, those who are immune compromised, people 65 years old and up, people with underlying medical conditions, and our frontline workers. For all of those groups, a booster is recommended if you got your initial shot 6 months ago or more. If that's you, you're eligible to get a booster. You can go to the pharmacy, you can go to your doctor's office, a community clinic, the health department to get a shot. You can go to vaccinate.virginia.gov to find locations near you. And I want to repeat that just one time. You can go to vaccinate.virginia.gov to find locations near you. And when you get there, it's on the honor system. The person giving shots is not required to ask you about your vaccination status. So it's up to you to do the right thing. And I would also say that if there are questions about whether you qualify, whether you should receive a booster, please ask your physician or your provider and they will give you guidance. Remember, for now, this is only if you got the Pfizer shot. There's not yet a plan for booster shots for the other vaccines, Moderna and Johnson & Johnson. These companies are filing their research materials with the federal regulators, and we should all know more in the coming weeks. So for now, if you got the Moderna or the J&J shots, you don't need to do anything. Just be patient and pay attention. Now, let's talk just a bit about children. I know many parents of young children are anxious to get them protected. As a father and as a pediatrician, I understand how you feel. But we need you to be patient for a bit longer. There are two important things to know. First, kids under age 12 are not yet eligible to get shots. We expect that to change in a few weeks, and for kids to become eligible around the end of October or beginning of November. It takes more time to conduct this research for children because children are not just little adults. Their bodies develop in different ways at different rates. It's more complex, and everybody wants to make sure that the science is right and everything that we do for our children will be safe. The second thing you need to know is this. We have been preparing for a long time, and when approval comes for kids to be able to receive their shots, Virginia will be ready. It's good to think of vaccinating kids as a partnership between parents, public health, and our schools. Right now, kids are required to receive several vaccines before they can start school for things like measles, mumps, polio, and other diseases. Childhood diseases killed countless children years ago, before vaccines basically put an end to those diseases. You can walk through any old cemetery and see how many headstones belong to infants and small children. Vaccines change that. I would bet money everyone in this room got those vaccines as children, and almost every one of you watching at home. And we all know how this works. Parents can take their children to get shots at their own pediatrician or at the health department. Regardless of where you get it, your kids have to get their shots before they start school. The easiest and most equitable way to deliver the COVID vaccine is at school, to have the health department come in and give the shots. So our teams are working with school divisions and superintendents to do that wherever possible. I can't yet tell you the specifics because the plans are still in formation and nothing will happen before the FDA approval comes. Hopefully about 6 weeks, but maybe even a bit longer. But planning is underway. When the time comes, we'll be ready because we want to make sure that this is as easy on parents and children as possible. In a moment, I will ask the school superintendents from Arlington, Roanoke, and Richmond to speak about their plans. They are from different parts of Virginia, about 250 miles from each other, but I wanted you to hear how they are approaching the issue. I also want to acknowledge that we know there will be challenges getting young kids vaccinated. We have seen that with kids aged 12 to 17. They became eligible for COVID shots back in the spring, and the rate of getting shots among these kids roughly matches what's going on in the larger community. So here's what we know. There are about 420,000 children in school aged 12 through 15. So far, about 63% of them have gotten at least one shot. That's pretty good, but it's a little behind the rates for adults. But when you dig in, you find that just like with adults, there's a lot of range across the state. I found this somewhat interesting. Alexandria has the highest vaccination rate in Virginia. 98.5% of children aged 12 to 15 in Alexandria have gotten at least one shot, and that is tremendous, and I commend them. Arlington is doing amazingly well too, at 92%. But at the other end of the spectrum, the numbers are very different. For example, in Highland County on our western border and Patrick County on our southern border, just 17% of children aged 12 to 15 are vaccinated, 17%. Those are particularly low, but their neighboring counties aren't much higher. As I said before, by one important measure, we rank number 14 out of 50 states. But these wildly different rates are a good reminder that we still have much work to do. And we don't want to see the same trends happen with our younger children. That's why we're working hard to make it easy for our children to be vaccinated. Before we take your questions, I would like to ask 3 of our school superintendents to speak. We'll hear first from Dr. Francisco Duran from Arlington, then from Ms. Verlette White from the city of Roanoke, and finally from Jason Cameras from our home city here in Richmond. So first of all, Dr. Duran, thank you all so much for being with us.
Thank you, Governor. It's a pleasure to be here to share a little bit about the efforts that we're putting in place in Arlington County. As we are entering the third school year in the pandemic, it's very important that we put all the measures that we can in place to keep our students and staff safe so that our students can remain in school. That is really much our priority in Arlington County. What we did, you heard some of the numbers about our over 12-year-olds. We also have a mandate in Arlington County for our employees, and we have 91% of all of our instructional staff who are vaccinated. The model that we use in both of those cases is to provide clinics that are available during the day, during the afternoons, evenings, and weekends. And we'll do that again, and we're prepared to do that again for our 5 years and older. We work at each of our school sites, and we have afternoon and evening availability for families to come in. And when we have any days where they are non-student days, where we have staff perhaps early release for professional development, or perhaps we have a full day, those entire days and those times are also available at our schools for our parents to come and to have their children vaccinated. We're also working closely with our health department in Arlington County to provide releases that eventually, when we're able to get a larger number of our students vaccinated through the model I just described, we will then be able at local elementary schools to provide that for them there as well for their families. We also have a great partnership with our health department. We have weekly testing that occurs for any families that want to opt in. 25% have opted in. That's something that's getting done every week at every school. So our parents and our community are familiar with their ability to come to their local school and get those services that are needed. Our staff, again, were able to get their vaccination rate that high by providing clinics for them as well. So we're really excited about this opportunity, again, to find yet another way, yet another measure to keep our students and staff safe, keep them in schools this year and moving forward. Thank you.
Thanks so much. Appreciate it.
Good afternoon, and thank you, Governor, for inviting me. Dr. Lane, thank you also as well. I'm representing Roanoke City Public Schools, where I'm representing the student, staff, and school board of Roanoke City. So thanks again for inviting me to be a part of this very important conversation. You know, in Roanoke City, we have a slogan that's more than a slogan for us. It's "We are one." And that's really how we've come together as a community to be one body. That's how we've navigated this global pandemic. So I just want to stop for a second and thank our community partners. That's part of our strategy. It's really the collective nature of really having a school system versus a system of schools. We've partnered with the Virginia Department of Health, specifically the Roanoke Allegheny Health District under the direction of Dr. Cynthia Morrow. The Roanoke Valley superintendents get together on a weekly basis. We watch and follow the COVID numbers as well as the exposures and hospitalizations. We believe that that information is really critically important as we conduct strategic planning and as we're looking at our way forward. So we are really grateful for that partnership. As the governor said, many people are inundated, including our school nurses. And so we are grateful for our partnership with the Carilion Health System and for the work of our school nurses. I would say to anyone out there, if you get an opportunity, thank your school nurse. Because they have gone above and beyond the call of duty to take care of staff and students to make sure that they're dealing not only with COVID-19, but also with all of the other health issues that come along the way during a regular normal school year, all of the scrapes and sprains, as well as cold and flu. So we are grateful for our partnership with Carilion. We're excited to hear about the possibility of a vaccine for ages 5 through 12, certainly just like with 12 and up. We will hold vaccination clinics right on site. As you know, again, that's what our parents, we believe, would benefit from, and our students as well, to have the availability of those vaccines on site. So again, that's because of this collective partnership. We're also partnering with other community health partners. It's not just the physical safety of students, but it's also the social-emotional safety of our students. So we are just really grateful for those community health partners, not just the VDH, not just Carillion, but for instance, our behavioral health partners, the Blue Ridge Behavioral Health Partners. Again, this is taking care of the whole child and the whole community as one body. So we will continue to host those. We will soon have about 900 by next now test kits so that our school nurses will be able to conduct on-site testing, certainly with the parents' consent, to make sure that our students can stay in school. As much as we know that there are students who do well in a virtual environment, the majority of our students do best in person. And so we are doing everything that we can to follow our health mitigation strategies, certainly. We are staying physically distanced. We are following all of the hand washing, hand sanitizing procedures, masking. We have a mask mandate in place, and I'm grateful to our community for following all of those procedures. But we know that that won't always hold us. So we are excited about the possibility of a vaccine as another layer of protection for all of our students and staff members, particularly those who are between the ages of 5 and 12. So together, again, we are one, and we're looking forward to the upcoming vaccinations.
Thank you so much.
Thank you.
Thank
Good afternoon. I'm Jason Camera, Superintendent of Richmond Public Schools. Thank you, Governor, for having me here today, and thank you, Dr. Lane. I want to echo some of the comments that my colleagues have already made. First and foremost, a huge thank you, not just to our nurses who do their full-time jobs in addition to contact tracing, but our administrators and teachers and everybody else who interpret all of these guidelines, all of the mitigation strategies, and actually make them work in our schools, and oh, by the way, teach reading as well. I am happy to report that all of the mitigation strategies are working. Here in Richmond, since we opened, we have identified approximately 200 positive COVID-19 cases amongst students and staff. The good news is over 98% of those did not occur within school. They occurred outside of school. And so what that tells us is the mitigation strategies are working, and I would venture to say the safest place for children in Richmond, and I would say all across the Commonwealth, is inside school. And so we are incredibly grateful for all the support we have received from the state, from the Virginia Department of Health, and many others to make that possible. One thing I do want to note, we have a number of quarantines as a result of positive cases, which is disruptive to learning after 18 months of already disrupted learning. And the very best way we can limit quarantines is to increase vaccination amongst our students, our staff, and our community. We have a vaccine mandate for our staff precisely for this reason, but we also appeal to our community to increase the vaccination rate, and we are thrilled that once the vaccine is available for younger students to be able to provide it to them as well. And we will do so at our schools. We believe we need to make this as easy as is humanly possible for our children and for our families so that we can get that vaccination rate as high as it possibly can be. Finally, let me just say thank you to our partners at the Richmond City Health District, to Dr. Avula. We talk just about every day, and I'm grateful for their partnership and for the partnership of the Virginia Department of Education as well. We look forward to getting shots in arms for those little ones. As a father of a 10-year-old myself, I'm eager to make sure he gets that vaccine. Thank you.
Thank you so much. Really appreciate it. Well, I really appreciate all of you for sharing some time and all the great work that you all are doing. And as you said, to our nurses, our teachers, our administrators, school staff, for just everything that you all have done over the past 18 months. And I know that our schools have faced enormous challenges from this pandemic, but our teachers, staff, and our children have really been troopers throughout this. And from the beginning, we have followed the science, and we know what our schools are doing is working, and we know that the safest place for our children to be and where they need to be is in our schools. So again, I just on behalf of Virginia, thank you and the other superintendents across our Commonwealth for all that you do. In fact, just last week, I thought you might find this interesting. The CDC published 2 scientific studies that show clearly masks protect children from COVID, even when community rates are high. One study looked at Arizona and showed that schools without mask requirements were 3.5 times more likely to have a virus outbreak as schools that did require masking, 3.5 times more likely. And the other study looked at 520 counties around the U.S. It found similar results. In counties without school mask requirements, pediatric COVID cases increased at a far higher rate after school started. The science is clear. Masks in schools help protect our children. And vaccines protect our children too. This is a good time to remind everyone, Virginia needs your help. If you want to help get people, including children, vaccinated, our Medical Reserve Corps is always looking for volunteers, and just the output of folks that came as volunteers is just commendable. But this could be a great opportunity for retired teachers, especially, to help in the school communities where they already know a lot of the families. In closing, I will remind everyone, if you want to see this pandemic end, if you want your kids in school every day, not quarantined at home, and you want high school football games and a return to the time when you just didn't have to worry about this, there is only one answer: get vaccinated. It is the only way forward. I'd be glad to take questions.
We'll start with
Andre.
Andre.
Governor, we have a lot of health agencies who are facing a potential problem in that they've mandated the vaccine for their caregivers, but some have said they will not take the vaccine. Is there any funding available to help some of these health agencies retain staff and even bonuses to hire more folks? And that same question would be for those working in corrections. There are some people that we have heard from who said they worked in corrections for a number of months now during this whole difficult time, but yet there is a program whereby new people can get bonuses and such.
Yeah, no, it's a great question, Andre. And you know, there's the ARPA funding. We've talked a lot about that. The legislature, you know, they decide how that money is spent, but and there are other sources as well. And we are in almost daily communication. I know Dr. Carey can vouch for that, with our hospital systems and doing everything that we can to help. And there really, well, there are a lot of challenges, but 2 of those challenges are beds, and especially ICU beds, and probably even more of a challenge is staffing. And I'm going to be quite blunt with you. I have spent many a day in the hospital, and I know I have some other physicians up here with me. Andre, people are losing their patience. They're getting tired. They're exhausted. They're seeing people die in front of them every day, people that can't be with their families. They're the last ones that hold their hands, these providers. And it's getting to the point where they need our help, and that's one of the reasons why I'm up here today, because it's getting to the point where what we worry about is that nurses and technicians and custodians and the people that do the day-to-day work in the hospitals they've had enough, and they're going to at some point say, I can't take this anymore. They're all human. And that's worrisome for 2 reasons. One is that the COVID-19 patients are not going to have staff to take care of them. But there are also, you know, a lot of other reasons people go to the hospital. They may have had chest pain or you know, shortness of breath, or their diabetes may be, you know, out of control. They may have some type of infection. I mean, I could go on, And we don't want to get to that point, to the point where there's not enough staff, there's not enough beds in hospitals. And so I just ask everybody out there that, you know, again, we talk about this. This is a war. This is a biological war. And we all as Americans, we all as Virginians, it's not a between you versus me. We're fighting a virus. And we've all got to step up to the plate and be part of the solution. So you know, in response, because we're looking at all those options, Dr. Carey, our health director, Norm Oliver, who's here, and we'll do everything that we can to keep the staff and to keep the beds open, but it's getting to the point where we don't have as many answers as we'd like.
We're going to go on the phone, and just a reminder to please keep your questions to one question, because we've got a lot of people here today.
Okay, do we have David McGee with the Bristol Herald Courier?
Yes. Thank you for taking my question. Governor, do you have specific goals for the numbers of children that you want to see vaccinated? And if so, how difficult do you think that's going to be able to meet those goals in areas where adult vaccination rates are low?
I thought that was kind of like a setup question. Do I have a goal? I do 100%. That's an easy answer. I know that that's not realistic, but you know, it's interesting. We did a poll. Dr. Avula was part of this, our health department, Dr. Carey, a few weeks before we knew that vaccines were going to be available for 12 and above. And we did the poll statewide with the help of VCU, by the way, and looked at what percentage of families would encourage their children to be vaccinated. And it was around 60%. And so we're actually pleased that we've gotten over 60%. It's around 65% of children 12 and above. But we'd obviously like that number higher. And you've heard us talk about this. You know, herd immunity. We'd like 75 to 80% of the population vaccinated. And I realize there are religious reasons, there are medical reasons that some individuals can't be vaccinated. But the great majority of us can be vaccinated, and so we're going to do everything we can. And again, I commend our school leaders. We're going to have vaccination clinics at our schools to make it as convenient as we can for these families. But you know, I would love to see 80, 85%, or even higher of our children get vaccinated, and so that's what our goal will be.
Governor, considering how hard you went against the unvaccinated today, can you give us an update to the state vaccine mandate percentage breakdown of those getting tested weekly versus those vaccinated, and would you consider following the likes of other organizations and removing the testing requirement? It's either exemption or get vaccinated.
It's a great question, Cam, and the question is what percentage of our state agents, state workers, employees are being vaccinated? And as you all know, we mandated vaccines for state workers. We have over 100,000 state workers, and the numbers, Cam, are about the same as the general population in Virginia, so around 75% to 80% in that ballpark have gotten at least one shot. But we're going to continue to work with them. I know I've said this at a lot of different press conferences. All options are on the table. We will continue to encourage. As you know, individuals that are choosing not to be vaccinated have to show proof once a week of a negative test. And so we're going to continue on that path for right now, but we certainly discuss the options every day. We look at the numbers every day, and again, we're going to continue to encourage everybody to be vaccinated.
Okay, do we have Bruce Potter with Inside Nova? Okay, what about Donna with the Washington Post? Is that, okay, Jimmy with the Suffolk News Herald?
Hi, Governor. Thank you for taking the question. With the number of school divisions, have had staffing concerns, whether it's with bus drivers, teachers, other staff members in some districts, I know are using teachers to fill in classes during their planning blocks because there's not enough subs and too many staffs are out with, various quarantines of their own children. What what are schools doing to be able to handle the staffing crunch when there's already, shortages, within that without illnesses or quarantines, having an effect?
Another good question. And yes, our schools are seeing challenges with staffing. Hospitals are seeing challenges. Businesses are seeing challenges. And the answer to those challenges is to get vaccinated. But Dr. Lane, do you maybe want to touch on how we're addressing some of those issues with, I think the question was with bus drivers and substitute teachers and other full-time teachers, but how you're addressing it. Thank you. Not to put you on the spot.
Thank you, Governor. One of the big things that's going on right now is in the special session of the General Assembly. The General Assembly set aside $11.5 million for bonuses for staff that are hired in this late time to make sure that we can have a teacher in every classroom. In addition to that, we've been monitoring a lot of the local situation and bus driver shortages specifically, and we've been proud to see our school divisions step up and increase salaries, especially for bus drivers. Ultimately, for us to have the staffing that we need in schools, we're going to have to pay a salary that incentivizes people to come to our schools. And so we'll continue to work not only in future General Assembly sessions, but beyond, to make sure that we have the staffing that we need. And I was proud that the governor signed a budget that had a 5% increase for staff this year.
Thanks, Shane.
Beyond the executive vaccination mandate for state employees, as you mentioned, some communities are still struggling to really boost their full vaccination rates among their population. So I'm wondering if the state has considered other ways to increase those numbers, either through greater outreach, or finding regulatory ways to mandate it. And sort of along the same lines, I mean, have you considered supporting or introducing legislation that would require vaccinations for school children in the next school year?
Those are all good questions, Kate, and I think there are a lot of things that we can do as governor, and some things that I can't do. I have done everything that I can, and that is by mandating vaccinations for our state employees, which is, as I've said, is over 100,000 individuals, and we'll continue to keep that mandate in place. But I think what we need to do moving forward, and I think it kind of touches on your question about what can we do to get more people vaccinated, and especially, I mean, you saw the numbers like in Alexandria and Arlington, and then other counties like the Highlands and Patrick County. What's going on there? And what I'd like to see is our community leaders. We're able to set up vaccination clinics wherever we want to now. We have the supplies, and we have the people that can do it, and we have the supply of vaccinations. I'd like to see our legislators, for example, Republicans, Democrats, Independents, say, you know what, in order to get this pandemic behind us, we need to get people in my district vaccinated, and I want to set up a vaccination clinic to do that. But, I'm not hearing enough of that. So I ask our legislators to step up and be part of the solution. Some have. Obviously, some others need to do better. And also community leaders, athletes, or faith leaders. We need to have all these people, part of it. We had to have people that will be listened to. And so as we move forward, we want to continue to do that. I couldn't be prouder, Kate, of the efforts that have gone on in this Commonwealth. We're the most highly vaccinated in the South. There are so many people that work for the state, that are volunteers, that work for our health systems. I was just at an event yesterday where a healthcare system was out there offering vaccinations, both for COVID and the flu, by the way. And so we've done everything we can. We just need, again, to impress upon people that we need to all be part of the solution. And here's what's going to happen. Here's what will happen. Delta will go, but there'll be another one. And that one will go. And I can show you the graph again where we're going to have peaks and troughs in it, and that is the way these viruses survive. They are smart, and we can outsmart them, and that's by getting shots. But if we don't, whether it's Delta or Echo or Foxtrot or go right down the alphabet, we're going to continue to have variants, and again, it's avoidable. And it's avoidable by people going and rolling up their sleeve and getting a shot.
And on the same lines, would you support a mandate for school came out or could be passed down?
Kate, there are a lot of options on the table, and we're going to do everything that we can to make the vaccine available. As far as a mandate by children, or for children rather, we have 140 legislators, for example. I think we need a lot of other people to buy into that concept, and I am all open ears. And we can work together with our legislators, with our community leaders, our faith leaders, and come up with a plan on how best to get shots in arms. But all those options are on the table.
On the phone? Okay. Bill Atkinson with the Petersburg Progress Index.
Governor, I take this question from the opening of your statements and the tone of your statements from the opening of this press conference. Despite pleas from the state and work across the state to increase vaccine access, there's still some areas, such as down here in Petersburg, where the number is still way below 50%. In your opinion, has the line been blurred between access to the vaccine and people simply digging their heels in against the vaccine, and how do you think that line could be, the focus on that line could be sharpened?
Yeah, I appreciate the question. And, you know, Dr. Avula is here, and Dr. Carey, and Dr. Oliver. And regarding access, you remember, let's go back a little bit in history. Initially, we didn't have enough PPE. Finally, we were able to get enough PPE, and then we needed to have everybody have access to testing. We didn't have the swabs, and we didn't have the reagents, and the labs weren't set up to do the testing, and we were able to accomplish that. So now individuals can go out and get tested. And then in late December, vaccines were available, and people were, you know, doing everything they could, jockeying around to get to this clinic, to that clinic. Some of them were going to other states. And in time, Danny, and I appreciate your efforts, we now have access. Anybody in Virginia, we've got mobile units, the health department, your providers, the community clinics. They're just, the access is there. And we have the supply of all 3 vaccines. We will have the supplies for, and we do now, for the Pfizer booster. If Moderna and J&J have boosters, which I anticipate they will, we have the supplies. So all of that's in place, the infrastructure and the supplies. We've got everything that we need. We just need cooperation. And I know I sound like a broken record, but we're doing everything that we can, and now we're asking for your help to get this pandemic in the rearview mirror. So I've done everything I can, and if there are other thoughts out across the Commonwealth of what we can do to get more shots in arms, I'm all ears.
Governor, could you give us an update on the larger vaccine clinics the state is hoping to open, kind of where we stand on those, kind of capacity numbers you're hoping to see there and all that?
You all, Danny? Yeah. Welcome, Dr. Avula. Thank you, Danny.
Thank you, sir. The question was about larger vaccination centers and what's the status of them. We're in the final stages of finalizing the contracts with a vendor. That should happen sometime in the next couple of days. I would expect they need about a 5-day ramp up. And so in the planning stages, we had looked at about 10 sites around the state. We anticipate, based on the criteria the CDC provided about who is eligible for a booster. Remember, it's Pfizer, and it's 6 months after, so that's about 700,000 Virginians who are eligible right now. Approximately 350,000 of those are healthcare workers, and their health systems will be supporting a lot of that vaccination. So, you know, in terms of who's eligible, we really do have a pretty robust delivery infrastructure between our amazing pharmacies who are everywhere, who have been vaccinating so much throughout this. We have 2,700 providers who are approved to vaccinate out of their practice sites, and then we have health systems, health departments that are continuing to fill in some of those gaps. So there is not a burning need right now for these large-scale vaccination centers. As we get towards the end of October, that need will increase when we anticipate that the Moderna booster will be approved, and then that'll probably overlap with the 5 to 11-year-olds. So we'll continue moving forward on these. I think the need is going to be more than met by what we have now, but we're preparing for that peak at the end of October.
Governor, earlier a question referenced your directive that state employees be vaccinated or weekly show proof of a negative test. Specifically with regard to Virginia State Police, I'm unaware either way if they have put a plan in place for troopers that are not vaccinated to show proof of a negative COVID test. Had you heard anything from the state police or about how they're handling that directive?
I have my Secretary of Public Safety here, so he's making his way up here. But if it's okay, he'll address that. Thank you, Patrick. Thanks, Brian.
Yeah, question having to do with our Virginia State Police and complying with the vaccination order. They are following the Department of Human Resource Management guidelines, and they're working diligently to bring that vaccination rate up. We have civilians, which about 80% vaccination rate right now. We're very proud of that. And then we have the sworn troopers, which is less than 80%. And so we're using all the same methods that the governor has expressed today in terms of messaging just how important getting a shot in the arm is right now. And so they're following all of the proper procedures in terms of vaccinations. And if you're not getting vaccinated, you got to take a weekly test. But we're
the vaccination rate for troopers?
It's just around 60 to a little north of 60%. Yep.
Thank you all for being here. And just in closing, I think that it is so important for us to provide updated and accurate information to our fellow Virginians. And I wanted to take this opportunity. I appreciate all the networks, all the journalists. I appreciate the questions. Sometimes I probably don't give you as good an answer as you'd like or as clear an answer, but we couldn't do this without you. And so I really appreciate moving forward, you all being part of this and making sure that Virginians get the information they need. I must say that I have enjoyed getting to know, as I look around the room, a lot of you. I consider you colleagues and friends. And again, I know it's not easy work, but you're doing very important work. And those of you that are listening at home, I thank all of these folks from the press for getting you the information that you need. So stay safe out there. Again, we can beat this virus, but it's going to take all of us. And I just ask all of you to be part of the Virginia, to be proud Virginians, and let's get this pandemic behind us. So thank you, and until we meet again, Cam and Henry, I don't know if you have any thoughts on when we need to meet again, but we're all ears. So they're looking at each other, but you all stay safe, and we will see you soon. Thank you so much.